What is going on, YouTube Nation? This is Dark Dividend. If you guys are new to my YouTube channel, make sure you subscribe and hit the notification bell so you don't miss future videos. Doge, what is going on there? I have no idea. I mean, it's just crazy. I just started investing in the crypto business. I literally woke up at 3 in the morning and I'm like, I need to get in crypto now. But really, I'm going to be buying more Pfizer stock, and I am long in Pfizer stock. And this is kind of a collaboration video. I'm going to refer you to one of my buddies, so make sure you subscribe to his channel as well as hit the notification bell so you don't miss future videos. So Pfizer is a crazy pharmaceutical juggernaut. I mean, everybody's discussing their vaccine, how vaccine, this and that, what happens after the vaccine's done. Well, these guys are going to be strong. Moderna, they're just a vaccine company, so they don't carry products to help people in the hospital or when they're outside of the hospital with a lot of pharmaceutical products or things over the counter or things that are prescribed. So this is what gives Pfizer the edge and why I'm long in Pfizer, and I prefer Pfizer over Moderna, or many of you dividend investors want to know why Pfizer's a great dividend stock. I'm going to do a very short stock and dividend analysis, but I'm really going to emphasize the products that Pfizer carries, medications that I've pushed, medications that I've seen. I don't want to go really in depth because I don't want to confuse you or have your head spin in circles. I'll try to be as brief as possible and as basic as possible. And I better know because I'm taking pharmacology this summer for nurse practitioner school. So this is a good brush up for me before I start taking my classes. So I'm going to try to explain to you guys the way if I have a medication ordered by a physician, what I tell my patients and why they're taking this product, because you want to know what these products are, you want to know if these products are efficient, and you want to know why these products are important to consumers or important to your health. So I'm going to try to be as basic as possible. We're going to jump to my buddy's page real quick so that you can check out his channel real quick. I'll have it also in the description, and I'm going to stop for a few seconds when I'm on there. That way, if you have a pen and paper, you can stop the video, write his name down, and go to his YouTube channel. So we're going to check this out right now. I'm going to stop for a second so that you can freeze this video. Write down PPCIAN. He is a guru. He is one of the reasons I started to make YouTube videos. He inspired me to keep on pushing myself when it comes to dividend investing. So he is a legend. He will eventually be at 100,000 followers. He also has a crypto channel. So he really got me interested in crypto. I was always very little iffy on crypto and a little scared, to be honest with you. I did have a huge investment that blew up in my face with Rich Uncle / Motive now, but since I'm well diversified, I am doing pretty well right now, and because of him, I invest in crypto. So he also has a crypto channel. So let's check out Pfizer. As you see in the corner, I have products that Pfizer carries because I will jump to the product side in a second. So let's just jump and see how Pfizer is doing right now as a stock and its dividend history, and then we're going to jump to the products. So Pfizer is a pretty good stock to buy at $38.57. This has increased its dividend over time. It has done well against the S&P, but the S&P is really catching up to Pfizer as a company, which makes it an attractive stock. Because when I invest in stocks, sometimes things I just can't keep up with. I had to sell IIPR. It was up like 500%. It was just really taking advantage of my M1 Finance dividend portfolio. I wanted to put money in and distribute dividends into it, but I just couldn't because it was blowing up. So this is a real good, stable stock. This is an affordable stock that has done well overall, and you better get it before it goes to right about $40. So it's less than $40. And I'm going to jump to its dividend history real quick, which makes it an attractive dividend stock. So this is why many of us are long in it. I mean, a few years ago, 2013, it was 24 cents. Now it's all the way up to 39 cents, a 4.2% dividend yield, PE ratio at 21.99, annual dividend of $1.56. So over time, these guys have a very good reputation of increasing their dividend. Revenue-wise, they have done well. And with these products that I'm going to reveal to you that they sell to the hospitals, and it's some things I hang or push as a nurse, or medications that you guys are prescribed outside of the hospital. This is really important for you to understand why Pfizer's a great pharmaceutical company. Now, again, I'm going to address, I am not a financial advisor. I'm not giving you medical advice. I'm just telling you what these products are about and what they're capable of, and why people take these medications prescribed by healthcare professionals. Okay, so I'm going to go over A to Z. I'm not going to go over every one of them, but I'm going to explain to you some of these oral medications that Pfizer carries that are very popular for the consumers. First of all, first big one is EpiPen. So, you know, if you carry an EpiPen, if you're allergic to bees, if you're allergic to peanuts, EpiPen, you basically inject yourself if you're having an allergic reaction to save your life. So that is a very popular medication that is in demand. So Acupril, aka Quinapril. So with people that have low ejection fractions or congestive heart failure, they prescribe a ACE inhibitor or an angiotensin receptor blocker. So basically what happens is these medications, there's a few reactions that go on with the body, and there's a angiotensin receptor and renin and all that. So basically it helps with heart failure. So people that are in heart failure, that we call it core measures. You have to follow core measures with like a beta blocker, make sure that they're taking a ACE inhibitor or angiotensin receptor blocker, unless their kidneys are beat up. Like if your kidney function is terrible, you normally don't want to be on a ACE inhibitor, Acupril, or other medications. Next medication is Mucomist or acetylcysteine. So I'm not sure which form this is carried in, but acetylcysteine is a medication. If you ever go in a hospital and see a patient that has have a family member or visiting a family member and it smells like rotten eggs, that's probably acetylcysteine. It's kind of like foggy too. Like the room will be fogged up and it smells like rotten eggs. That kind of loosens up secretions. But the other thing that acetylcysteine in IV form is people that overdose on Tylenol. It's actually an antidote for Tylenol. So it pretty much makes it, people unfortunately that are suicidal or trying to grab attention, they will overdose on Tylenol. Acetylcysteine will save their life. So that's one thing that's very interesting with acetylcysteine. Is the other name is called Mucomist. So adenosine is a medication. We call it the adenosine challenge. So if people have supraventricular tachycardia, we call it the adenosine challenge. And of course, you never want to tell your patient before you push this in them and you have an EKG attached to them and a crash cart right by them. Oh, by the way, your heart's going to stop for about 2 seconds, and once it hits the liver, it's going to detoxify and be gone. That's not something you tell your patient, but sometimes it can correct people. We try from supraventricular tachycardia to just to get back a normal sinus rhythm. Supraventricular tachycardia, their heart rate's in the 150s, and you just can't do anything to try to fix it. We try to push 6 milligrams, and then we try to push 12 to see if we will fix it. Hopefully, these people aren't really symptomatic or in bad shape. Then you have to do the next option sometimes to zap them. So we don't, but this is the first line. It's very safe. It's very quick to fix people sometimes, and sometimes it just doesn't work. I mean, I've pushed 6, and all of a sudden you call the doctor, and one time I had a patient that was like ready to go, and all of a sudden they hit supraventricular tachycardia. You call a physician on their cell phone. Yeah, can I push this? Get a verbal and do an EKG? Sure. Boom. Adenosine. Boom. So we would just, again, we never tell our patients that, it's going to stop their heart temporarily. it wears off extremely fast. The moment it hits the liver, it just is detoxified and gone. Next thing is spironolactone hydrochlorothiazide combination. So spironolactone slash aldactone is a special diuretic. It's which we call the P pills. It spares potassium. So sometimes when you take diuretics um, like Lasix and stuff, um, or HCTZ hydrochlorothiazide, these diuretics, you can lose sodium, you can lose a lot of electrolytes like potassium. Aldactone basically spares potassium because if your potassium is too high or too low, you got a problem with cardiac arrhythmias. You just don't want that. So as I referred to as aldactone, here we go. All right. So amiodarone, this is a very popular anti-arrhythmic. It lasts a long time in your system. It's amazing how long it'll last in your system. So this is a oral medication that people take, or they get a loading dose, sometimes IV drip. And I tell you what, if that IV is not working and that goes outside the skin, you can get severe burns. But it is a very strong antiarrhythmic. It helps people stay in sinus rhythm or have prevents heart arrhythmias. It's just a very popular medication. It takes a while to do a loading dose and stay on top of things. Let's just go over a few of them that are. So atropine, this is a medication that we call it if somebody's heart rate is really low, say like whether it's medications, they took a beta blocker and their heart rate's too low, or their heart rate's just generally too low, we push atropine 0.5 milligrams to try to get their heart rate up. Usually it doesn't work, especially if they have really bad, like if they're bradycardic and they're symptomatic, like they stand up and they got hit by a hurricane. But we push atropine to see if that helps. And if it doesn't, then we just put them on a pacer, automatic pacer, and wait for the electrophysiologist to come in and insert a pacemaker. So the next medication is azithromycin. That's a very strong oral antibiotic. We call it the Z-Pack. So sometimes you might be, if you're discharged, you go to your physician, they'll order a azithromycin for you. So that is a very popular medication for people that have lung infections or pneumonia. Let's go to B. Let's see what are some good ones that are pretty popular. Trying to find some really good ones that are popular. So Cadura, that's a really popular cardiac medication that we give. So and actually it's pretty powerful. So you got to be careful when you're passing medications. Here's one, ceftriaxone Ro7. So this is like the number one medication as long as people aren't allergic to Ro7 or ceftriaxone. This medication, basically, if you have a urinary tract infection, this is the first one they usually give you in the ER. It's broad spectrum, so it usually goes after a lot of bacteria, A, B, C, D, E, F, G. So obviously you need to make sure what the urine culture says before you really pinpoint what the bacteria is. Sometimes physicians will just stick with this. All right. Cipro, this is a antibiotic. Sometimes it's a pretty well-known antibiotic that people take. I'm sure if you're allergic to it, that's one thing, but this is a very popular oral antibiotic for people. I'm just going to go up and down. I'm actually going to jump to Lyrica. That's one that here's a really good group right here. The L's. I'm just going to go over the L's. There's just so many, but this is probably the biggest one, the biggest products that these guys carry. The L's. Labetalol is a very strong. It it helps you with your heart rate. It's a beta blocker. It helps you with your blood pressure as well. A lot of people in the post anesthesia unit will push labetalol to help people with their blood pressure, but you got to be careful with people's heart rates and stuff when you do that. So this is another name for this is Keppra. So that thing's getting in the way. So that helps with people that have seizures. So people who come in the hospital that are non-compliant with their medications, that have seizure activity, sometimes they're not taking their Keppra. So this is a very popular seizure medication that people are discharged with out of the hospital, or when people see their neurologist for seizures. This is a big one that is prescribed. So another name is Keppra. Levaquin or levofloxacin, that's an oral antibiotic. It has a little bit of controversy to it. People talk about tendon tears and stuff, but it's a very good antibiotic. It's for sometimes some physicians will do it for whatever they find in their cultures. They'll do Levaquin. Some people will stick with it for potential UTIs, urinary tract infections. Mostly people will do that for upper respiratory infections. So people will be discharged with that, or your physician will sometimes give you that. So lidocaine, this is a numbing formula. Sometimes you will get lidocaine injection. I'll see it with people who need chest tubes in them immediately. They will have lidocaine injected in them. So when you think of the dentist, like Novocaine, down there, that's a derivative. The canes are a derivative, so kind of like numbing. What's crazy with lidocaine, you can actually be on a lidocaine drip if your rhythm starts going crazy. So that's another. It's kind of crazy how certain medications and certain forms work. These ones right here, Lipitor. Jesus is getting in the way. Lipitor is a statin. So a lot of you guys that have high cholesterol issues, Lipitor is prescribed to you for basically to try to reduce your cholesterol levels. We follow these things with core measures. So if you have heart issues, or if you have a history of stroke, like heart attack or stroke, you are prescribed Lipitor. This is probably Pfizer's marquee and mothership medication that they have really, given to the market. So Lipitor is huge. So look at how many people in the United States actually take Lipitor or a statin. So that's one thing I just want to let you guys know in regard to cholesterol. Lipitor is a huge medication. So lorazepam, it's an anti-anxiety medication. We also give it to people who are in alcohol withdrawal. So a lot of us who try to be frugal, we try to watch the booze because it's expensive and everything. The alcohol tax in Ohio is ridiculous. But lorazepam will help people with sleeping. So some people take that as a sleep aid. It's an anti-anxiety medication. It is also like I said, with alcohol withdrawal, it kind of masks the excitability of the chemical, reactions that are going on when people are going through alcohol withdrawal. So alcohol withdrawal can kill you. Benzos like lorazepam are huge to fight off, the withdrawal symptoms. Sometimes people have to be intubated. That's how bad it is. So Lyrica is a big one for people who are diabetics. If you have nerve pain, unfortunately with diabetes, it is on the rise. So Lyrica is a medication that people take to relieve nerve pain. And one hospital system I was at, like they listed as a controlled substance. Another hospital system where I work at, I'm kind of surprised they don't list it as controlled substance. But this is a medication that basically is for diabetics. So you have nerve pain. It's not just for diabetics, but if you have neuropathy or nerve pain, this is a very popular medication that is prescribed to people. So I'm going to jump to some of the IV products that they discuss with Pfizer, because I just want to go over some oral medications. These are just some of them that are very popular outside of the hospital. Now we're going to start talking about in the hospital. I did discuss a few things in the hospital, but now we're going to talk about out or like on the floor, like medications that I see that is really powerful medications that are important to patients. Okay, so I'm going to start from top to bottom. Again, in this video, do not take this as medical advice. If I am, I am a student right now in nurse practitioner school. Obviously, look into these medications yourself before you even make the call, or make sure your physician prescribes this to you. I do not want to lead you astray in anything that I'm telling you. I'm just going over products that Pfizer sells. I am not, paid by Pfizer to give this lecture or anything. This is just a collaboration video. I just want to let you know what you're getting yourself into for buying Pfizer stock and the potential of Pfizer with many of these products. Okay, so dextrose injection, D50, D5, D25. This is okay if people are pretty much, if your blood sugar is low, okay, and diabetics sometimes when they come in the hospital, if their medications are doing too good of a job. And if I'm going to backtrack, so say like people that are taking the ACE inhibitors that we're telling you about, and if their kidneys are beat up, okay, their creatinine's a little bit elevated, and they take medications like insulin or medications that help decrease their blood sugar, like Amaryl, if the half-life is extended because the kidneys are important for detoxifying medications, but if they're too long in your system because your kidneys are not doing well, so basically what I'm trying to say is if your liver and kidneys have impairments or issues, medications can stay longer in your system to detoxify. So people that have medications, okay, we should say diabetic medications, if it's too long in their system because their kidneys are beat up, their sugar is going to drop, sometimes significantly. And usually you want your sugar between 70 to 100. Some people say 70 to 110. I'm just going to say above 70, okay? And if it's below 70 and dropping significantly, we just push dextrose to the IV and you feel like $1 million. You don't feel hypoglycemic. You don't feel sweaty or pale or irate or irritated. That stuff's in you right away and you're good to go. So again, here we go with mucomyst acetylcysteine. Let's see what form this is. Okay, so this looks like this is, I think looks like that's part of the mist form that people are getting. So edamame is a medication that you knock someone out in the middle of a code to pretty much paralyze them. So you're almost like you're intubating someone and you give them edamame in a code. That is a urgent medication. So I just want to let you know what that one is. Adenosine we went over with the adenosine challenge. Let's see. Atropine, we went over that. Bacitracin is an ointment, which is very important. Let's see, what else do we have there? Calcium chloride injection, that's a very popular medication. If your levels are low, you need it, in a bag or a form to get it. So you really don't want to push calcium chloride like right away. It's usually mixed, with other things. It's kind of interesting that they sell it in that form. I'm really curious to why they would have that there. I would probably just ask a pharmacist why they have it in that form. So Corvert's one of my favorite medications to hang. hangs really quick. So Corvert is one where somebody's like AFib or A flutter, and it's kind of exciting. You bring the crash card in, you hang it. Sometimes it converts them back to sinus rhythm. So if you have AFib or A flutter, it increases your chances of a stroke like big time. So that's why people that have AFib are like on Eliquis or Xarelto or Coumadin, because clots start like breaking out, and people start getting clots like crazy. Which makes me wonder with this Johnson and Johnson vaccine, um, if you look at the numbers of people, there's millions of people that have been injected by the vaccine. I would say about, geez, 6, 7 million or something like that, and only 6 people got blood clots. I want to see if these people were actually on not either they were smokers or they were on birth control. It seems like all these females are getting it, and the age group of people that are getting it, you can get blood clots from not get into AFib or A flutter, but you can get blood clots from getting from being on birth control. There's like a 1% chance. So it's going to be very interesting with that Johnson vaccine, what the results are. So, I just didn't want to jump the gun. But Corvert, it's really cool. It's hung really fast. And you see if they convert, it's real exciting. If they convert, if they don't, well, sometimes they got to be shocked and or go for a cardiac ablation to see if they can convert to sinus rhythm. Daptomycin, very popular IV medication in the hospital. Demerol, very, it's a well-known medication. I haven't seen it that much in there. People try to avoid, certain type of medications like Demerol out there. Here's Valium. So diazepam or Valium, that's another medication for people. A big one that I see diazepam with is people in alcohol withdrawal. It has a very long half-life compared to lorazepam, like IV. Lorazepam IV is better than Valium sometimes if people have really bad liver issues. So Valium we try to avoid, or diazepam we try to avoid that for IV pushes in people with alcohol withdrawal if their kidney function is bad. Here's Cardizem. That is a medication that we have to help people's heart rate. You got to be careful sometimes. It does too good of a job. Dopamine, that if you are in the ICU and your blood pressure is down and you're having issues, dopamine is a well-known medication for the ICU. And if you're tanking and your blood pressure is dropping, that's probably going to be the medication that you might have hung on you. So I'm just letting you know. Now, I tell you what, if that gets outside of the vein, usually we try to do midlines or central lines with this one, because if this gets like outside of your veins, your arm's gonna like burn and look like a crater. So I've seen burns with dopamine drips. It's really disgusting to see, actually. People need an emergency surgery, so you have to be very careful with a dopamine drip. Let's go over a few more. Fentanyl, everybody knows what fentanyl is. I mean, it's a pain medication. Furosemide, very popular medication. It's Lasix, so it's, people that have congestive heart failure that are in the hospital. We push Lasix into people to get fluid out of them. And the interesting thing is sometimes they're given also aldactone to make sure that the potassium is okay. So it's very interesting how these coincide. And Lasix, if you're having issues, it basically cleans you out. So furosemide is very important with people that are fluid overloaded or volume overloaded. people with congestive heart failure. This is a very popular medication to give. Just got to be careful it's not messing up the kidneys or the blood pressure, or electrolytes. So here's heparin. That's a blood thinner. I mean, we pretty much give people heparin injections in their belly, just about everyone in the hospital, to prevent blood clots from happening. And people that had COVID-19 in the hospitals, people I took care of, we would either do Lovenox or sometimes heparin, because all these people would get crazy clotting factors because of COVID. And it's really interesting. If you hear all these stories of people that were discharged in the hospital early from the pandemic and all of a sudden die at home, they probably had pulmonary embolisms. And had some of these hospitals gave heparin injections, or if the heparin wasn't a IV form, because one of the bags I saw earlier, it's in a bag. They put people on heparin drips if they have really bad clots, high level, and then they discharge them on Eliquis. So really interesting with heparin. It's a very popular medication in demand. You also, people that get dialysis and their catheters, they inject heparin in there. Or if you have a friend or family member that has a Mediport, if they're getting chemotherapy, heparin is usually pushed through that to make sure that the port is okay before you take the needle out, and then you just leave that port there. Heparin is a very popular medication. Hydromorphone dilaudid, that's a very interesting medication. Ketamine, there's a lot of research that they're doing with ketamine. I really don't want to get into detail with it, but they're discussing people with I think some form of depression. They're trying to do ketamine with that. Don't quote me on that one, but it's depleted because it's really interesting. They're trying to do a lot of research with this, with people in depression and such. I mean, I really don't understand it. Don't quote me on that. That's something you might want to Google search and look up. There's Keppra, Levaquin, lidocaine. So we went over multivitamin infusion. So before I load up a few other medications, this is what we call a banana bag. So people that this is actually pretty popular with people now. They go to Vegas, they get a banana bag to recover from partying. So this is given to people that are alcoholics. Multivitamin infusion. There's usually B vitamins that are depleted from people that have issues with alcohol, and they're also given that to try to get them in better shape. So this is what we refer to as the banana bag. So it kind of looks like Mountain Dew when it's hung, but it's a very important medication that I could see why it's depleted. Unfortunately, with the pandemic, there is a rise of people boozing. So that's one thing that's an issue. And what coincides with this is magnesium. Okay, let's see what form this is in. So this is in a bag form. So if people's magnesium is low, I'm going to tell you they have very bad cardiac abnormalities. So magnesium is always hung. If your mag is low and you have cardiac arrhythmias, I mean, you got to hang that, because it can be ugly. There's a thing called Torsades, Torseds, and it starts going like this, and you're in bad shape if your magnesium is low. So that's a big medication that we look at for people that are alcoholics, because their magnesium is sometimes low. So it's not just alcohol withdrawal with Valium and Ativan, but it's also magnesium with these people that are really that's important. Now here's a really interesting medication too, mannitol. Mannitol is a medication if you have, basically, your head is filled up with fluid and your intracranial pressure is going crazy, this is the medication of choice that they push in you. It's called a osmotic diuretic. It tries to relieve like basically fluid in your head, because if you get this fluid buildup, I mean, you can die. So you're trying to do what you can to save someone's life. This can save someone's life, mannitol. If first of all, this needs to be caught early with, this rise in intracranial pressure and fluid. But this is something you need to be careful of. If you see a patient, so this is important medication. This is a very important. This is a very important medication right here. Metoprolol IV injection. If heart rate's high, we push metoprolol. Labetalol is another one. Labetalol, like as I said before, is more important with. It helps out with blood pressure too. Metoprolol doesn't drop the blood pressure as much, but you need to be careful on the blood pressure because beta blockers, they relax the heart. So when the heart's pumping a lot, it just relaxes um, the heart and stuff. So here's let's see what else is a pretty popular one. Obviously morphine sulfate. Trying to see anyone that we really, well, here's penicillin. I mean, I'm going to sum up right there. So here's a potassium slow. Now I'm going to tell you something. You never IV push potassium. That'll kill someone. But I think that it's mixed. This is why they have it like this for injection. Like you inject it in the bag and then you hang it slowly. I think that's the way they sell this, so that pharmacists actually will mix it for you and then we just hang an IV. But you never want to push potassium phosphate. And I tell you what, not only would it potentially kill you with cardiac arrhythmias, probably would, but my gosh, it burns when it goes fast. So when I have my patients, I tell them, that need a little potassium there, if they have a peripheral IV, let me know if it hurts so I can slow down the rate in you, just in case. I don't want you to be miserable. So that can really irritate the skin on a lot of these patients. So I think I'm going to conclude. Here's sodium bicarb. So I'll stop after actually these two medications, these steroids and the sodium bicarb, I'll stop after that because I don't want your head to spin in circles. Sodium bicarb, so your kidneys are very important with fixing fluid and electrolytes. Kidneys are important with acid-base balance. They produce sodium bicarb, or they try to, let's just say that your acid-base balance is off. Sodium bicarb is important to stop the acidity, and you also increase your respirations to try to fix your acid-base balance. So right here, okay, with sodium bicarb, you'll sometimes need that. Sometimes it's needed in codes. You push that in someone right away to try to fix if there's any issues. Sometimes it is hung, okay, to try to help with the acid-base balance. So it's very important that you have a good acid-base balance. If your kidneys are beat up, you're not going to be making bicarb, so you have to take it orally. So, that's something that's important. And these two medications, I want to go over the Solu-Medrol and Solu-Cortef. People who have asthma attacks, people who have allergic reactions, these are non-steroid anti-inflammatory steroids that people are given to help relieve the breathing and help relieve if people have a reaction. So this is very important, a medication in IV form, IV push. It has helped people. I can tell you I have pushed this in people in codes that have had asthma attacks, and it has pretty much stopped their asthma exacerbation. So these are very important medications. So I want to know what you guys think of this video. Again, I'm just giving a quick lecture. I am not a pharmacist. Please correct me if I'm wrong with anything that I'm describing. I'm pretty sure I am dead on, but you can correct me at any moment if I am incorrect with these. I'm pretty sure I'm accurate. I better know this because I'm going to be taking pharmacology and I've passed a lot of these medications. So I just want to just be brief about some of these medications and why these are important for consumers or patients, and why this makes Pfizer such a strong stock. Because not just the vaccine, okay, they have a lot of products out there for people to save lives, and they're important to these people that need it, okay? So I'm just going to conclude this again. Ian, thank you for the shout out before. Ian, you were free to cut and paste any one of these videos if you want to put this on any of your future videos. This is a collaboration video. I'm just saying this in this video to make sure. I will also put it in my comment section that Ian has every right to put this video on his channel, or if he wants to cut out certain things and just do this lecture part, he can put this on his channel as well. So I just want to emphasize that. A lot of you dividend warriors out there, let me know what stocks you bought and what the hell is going on with Doge. I mean, I put money in it and it's just going crazy. So is it going to the moon or what is going on? I have no idea. So you guys have a good Friday and take care.